Hello, this is Lisa Whitty Bradley. I'm posting live from my living room. It's supposed to be Fireside, but I didn't have a good connection there. So I'm going to be posting here from my couch. Hopefully, I'll have some folks joining in. Um, my name, once again, is Lisa Whitty Bradley, MD. I'm a plastic and reconstructive surgeon in the Chicagoland area. And I have a company called Chicks with MDs. It's a limited liability company, and we've picked up a good amount of folks to follow us from social media, from Twitter, Instagram, Facebook, as well as the website. And I have a new electronic book that is talking about the next wave of healthcare reform, which has to do with value-based medicine. And value-based medicine is not new to the healthcare industry. It's been pretty much on this rollout for the last almost decade at least, but it started to be implemented over the last 2 to 3 years. And up until now, it's really just been with focused groups of physicians and healthcare centers. However, now, starting January 1st of 2017, the Centers for Medicare and Medicaid Services are rolling out something called the Quality Payment Program. And this is through MACRA, which is the Medicare Access and Chip Reauthorization Program. Hey, Dr. Connor Garcia, thanks for joining. And MACRA basically took the place of the SGR, which was the Sustainable Growth Rate, which was just plagued with difficulties for physicians and other healthcare practitioners because it continued to threaten healthcare reimbursement, which would limit practitioners' ability to cover and take care of a large number of patients. So this electronic book is really going to focus on the implementation of value-based medicine for a large percentage of practitioners that are going to be taking care of Medicare Part B patients. And I'm not going to go into a lot of detail on all of this stuff tonight. I just want to introduce you to the electronic book and let you know what to expect. So the electronic book will be available on our website, which is www.chickswithmds.com, as well as Amazon and iBooks. Okay. All right. You still there? Okay. I see you. So the benefit of getting the electronic book from our site is that you will get quarterly updates on any changes in the healthcare law and adjustments in the electronic book. And if you get the book from Amazon or iBooks, as long as you show proof of purchase on just send us proof of purchase, then we will give you a code so you have access to the updated version on our website. So nobody will go without these updates, because the most important thing about this book is to keep practitioners informed so that you can make the best decisions for your patients, that you can keep your practices financially sound, and then you can provide the best care, not only for your patients, but for your staff and for yourself, because it's very important that healthcare providers have adequate resources and are able to make sure that all of their financial their overhead and everything else is covered. That way they can provide the best care for their patients because they're not worried about financial burdens. So the book is officially out today. My web designer is working on the site as we speak. Unfortunately, there are some issues with WordPress, so he's having difficulties with the widgets on the website, but it will be up and running within 24 hours. So you can go to the website now and see coming soon, and I'm going to have a summary and what to expect from the book on the website. I'll have that tonight. I'll do that after I get finished with this talk. And just to let you know a little bit more about me, I'm just going to start over again. I'm Lisa Whitty Bradley. I'm a plastic and reconstructive surgeon in the Chicagoland area. And I was in a multi-specialty surgical group for the first 4.5 years of my medical practice, and then I left. That was in Central Illinois. I left there and then came to the Chicagoland area with my family, in hopes of starting a solo practice. And within a month of getting here, I was diagnosed with multiple sclerosis and and basically became a patient myself, which is another reason why I am so determined to make sure that we practice this law and implement things not just for physicians, but for and nurses and physician assistants, but also for patients. And I have I'm definitely utilizing these resources myself. I've seen the changes in the premiums, as a solo practitioner and being self-employed. I've seen the changes in the premiums. I've seen how quality value-based medicine has affected how we practice medicine. So I can see things from both sides. So I have an advantage. And then the other two authors of the book also have an advantage. One is a consultant with the Department of Health and Human Services and the Centers for Medicare and Medicaid Services. So definitely right on the ground for the people who are implementing these laws. And then the other author is a practicing vascular surgeon who works with once again, the implementation of value-based medicine and also educating healthcare practitioners. So all of us have a vested interest in making sure that we get the best information out there for you. Hey, Dr. Stevenson, how you doing? Oh, you're breaking up too? Maybe I should move. This is just not turning out to be the best room for this. Let me know, put a 1 up if you can hear the broadcast but not see me. I may just try and move to another room. So I'm just going to keep going. So I have that advantage of being a provider and a patient. So I know what happens on both sides of the table with the implementation of not only the value-based medicine, but the Affordable Care Act, preventative care measures, also with children's resources. But we will talk about all of these things in depth with the rollout of the ebook. So what we're going to do. Oh, hey, Dr. Mason, can you see me? It seems like I'm like in a black hole or something. So the ebook comes out today. The WordPress is having some issues, so hopefully the ebook will be up on the website as well as Amazon and iBooks within 24 hours. And what we're going to do is every 2 weeks, I will have a live broadcast, and we're just going to go through the book chapter by chapter. And every time we do the broadcast, I'm going to go through the timeline of the rollout of the quality payment program, just to keep you aware. And then we'll go through a specific chapter and the resources available and what you need to know. And that's the same thing that's going to happen on the website. Thank you, Dr. Mason. And trust me, I'm wrapping this up soon because I have your webinar to go to. So check out the website. That's www.chickswithmds.com. Also, follow us on Instagram and Twitter and LinkedIn, as well as Facebook. We'll do the bi-weekly broadcasts. We're going to talk about the chapters in depth, one at a time. Also, so you know, the format of the book, it's very concise and straightforward. So you have questions, or you have statements, and then you have resources and facts below that. So most of the questions or the statements, there are links, web links to all of the information that you need right below them. And then at the bottom of the last page of each chapter are resources and references for that chapter. This way you're not trying to surf the net and figure out all of this stuff. The resources are right there. And although I tried to keep myself to 50 pages, it's a little more than 50 pages, but it's all critical information. There's no fat on this book. It is streamlined. So all of the information there will be updated. Any emergency news blasts or updates that are provided by the Centers for Medicare and Medicaid Services, or HHS, we will provide on the website. I'll also put a blast on all of the social media platforms so that you have access to that. The most important thing is for us to be empowered. Make sure that we look at this as a business, because this is a financial entity that we not only utilize to take care of our patients, but to take care of ourselves, provide for our staff, and also take care of our families. Hey, Dina, thanks for joining. I'm just going to re-up and introduce myself again. This is Lisa Whitty Bradley, MD. I'm a plastic and reconstructive surgeon. I'm CEO and founder of Chicks with MDs, LLC. And I'm just introducing the electronic book, which is the implementation of the next wave of healthcare reform, which is value-based medicine. And the book is very concise, streamlined. It's statements or questions with immediate answers and resources. There are also diagrams that really explain a lot of the complexities of the quality payment program. There are resources about how to make sure your electronic health record system is certified, where you need to go to make sure that happens. Also, the website that the Centers for Medicare and Medicaid Services have provided to make sure that everything is up to date and you have all of the information you need for implementation of the value-based medicine. There will be, sorry about that, there will be a significant number of, hey, Dr. Val, there will be a number of resources at your disposal through the ebook, which will update quarterly. So every 3 months, there will be an updated version of the electronic book on the website. And like I was saying before, if you purchase the if you purchase the ebook through Amazon or through iBooks, we will provide you with a coupon code on the website to get the updating version, as long as you show proof of purchase, because we want to make sure that everybody is actively aware of all of the changes in healthcare reform. And this next year, I'm not even going to lie to you, it's going to be rocky, but that's okay. We will get you through this. We'll do it all together. Okay. So make sure that you stay tuned. There'll be every other week, there will be a new Facebook Live. And we will make sure that we keep you abreast of the timeline, the updates. There will be websites, e-links, everything that you need on that ebook, because it will update along with the Centers for Medicare and Medicaid Services and the Department for Health and Human Services. So I will also put out a news blast as soon as WordPress is up and running and all of the widgets on the website have calmed down and are working. So I'm going to finish up because I have a webinar to do with Dr. Mason on Beyond the Exam Room. So if you guys have questions or comments, leave them down below. Otherwise, please take a look at the website tomorrow, www.chickswithmds.com, or you can purchase the book from Amazon or iBooks. So thanks for tuning in. I really appreciate it. I'm very excited. This is like nerd porn for me. All right. I'll see you guys all later, and thanks for checking in. Bye-bye.